Good morning, good afternoon. Thank you all for joining today's webinar on building health for all during COVID-19. I'd like to just start with a little housekeeping. Today's webinar is eligible for credits, for AIA credits. We just got this confirmed this morning. So I hope that comes as a welcome surprise to many of you. I'm Joanna Frank, President and CEO of the Center for Active Design, and I'm delighted to be joined by two leaders in the building industry who are both addressing health and sustainability, Renee Loveland from Gerding Edlen and Melissa Gutierrez-Sullivan from Cushman, Wakefield. Just to kind of give you a quick run through about what we're going to cover today, I'm going to start with a discussion of really looking at what is the role of design and development practice in shaping the health and well-being of our communities, both where we live and where we work. I'm going to have particular emphasis really looking at mental health and how to design these places to really mitigate stress and anxiety. Renee will then share highlights of the best practices from Gerding Edlen as they work with their residential customers and occupants during COVID-19. And Melissa will share Cushman Wakefield's recommendations for workplace design and operations as we plan for a return to work. So I'm going to start with giving you a little history of active design. So we actually created the Center for Active Design with the belief that our built environment, both buildings and public spaces, could really be informed, should be informed with public health research, and really to ensure that they are optimized for the health of the whole population. And we had this belief that we could actually make a difference because of the precedent that New York City had set back in the 1800s. And so in the 1800s, just as a little history lesson, the majority of New York's population was dying of infectious disease. As you can see here, it was 57%. And the way that New York really looked to mitigate this was a wide-reaching set of both design and policy strategies. On the design side, the city created the park system. They created Central Park specifically as the working man's lung. They created the Croton Aqueduct and a reservoir system to bring fresh water down to the residents of New York City. On the policy side, New York City was one of the first to set design standards around the design of housing in the Tenement House Act, which really set minimum standards for light and air. And then on the policy side also, the city created a sanitation department to keep our public spaces and our streets clean. And New York City was very successful. As you can see, by 1940, infectious disease had really dropped off in New York City because of these changes to our built environment. And 1940 is an interesting moment in that it was before the widespread use of antibiotics, which didn't happen until after the Second World War. So we really derive a lot of confidence here that we, as all of those involved in designing and building our buildings, our streets, our public places, really have a role to play in mitigating infectious disease as well as all aspects of health. So as many of you know, we are the operator of the Fitwel building certification system. Fitwel is at this point leading as far as the world kind of leading the healthy building certification systems. It was first created by the Center for Disease Control and Prevention in conjunction with the General Service Administration. And we, the Center for Active Design, was selected as the operator of Fitwel just over 3 years ago now. And we've really been using the public health research base to ensure that all of the design strategies, operational strategies that we share through Fitwel are based on the evidence base. And Fitwel looks at health holistically. Fitwel actually uses 5,600 peer-reviewed public health research studies as the basis for all of those strategies. So we are already building off a real wealth of public health knowledge. We do not need to go out and reinvent the wheel. Public health research has been going on for more than 100 years, much of which time is looking at infectious disease. So in this time of COVID-19, I think, again, we should know that as building professionals, there is so much that public health research already looks at to inform how we design and operate our buildings. Today, we're going to really focus on instill feelings of well-being. And the reason for that is we're really interested in exploring how to design and operate our buildings and our neighborhoods to optimize mental health in a time where mental health is really being affected for COVID-19. So yes, we're absolutely going to talk a little about infectious disease transmission, but today we're going to concentrate on how do we really instill feelings of well-being through our design, through our operations, and how do we build trust both between residents and occupants of our workplaces. So this is kind of where I'm going to focus a little bit of my attention this morning. And I think one thing to know is that even before COVID-19, social isolation was amongst one of the 3 leading causes of preventable death around the world, alongside physical inactivity and smoking. Each account for just over 5 million deaths a year globally, and this is before COVID-19. So we know that with many of the practices of social distancing and social isolation, those social isolation numbers will have skyrocketed, and the impact on mental health is going to be considerable. A study that came out after the SARS pandemic actually showed that 16% of those surveyed after SARS were affected by PTSD, and 40% expressed higher levels of stress, anxiety, and negative mental health consequences. So we're really expecting that as we start to move through this initial kind of infectious disease acute period of COVID-19, that the mental health consequences are going to be dire. And there's a lot that we can do as building professionals to really mitigate this. So just to give you some of the stats on mental health and where they stood before COVID-19, and obviously this is going to change, depression is actually ranked by the WHO as the single largest contributor to global disability and anxiety is actually 6th in the world as well. So those 2 really account for a massive amount of global disability. This has a profound impact on health, but it also has a profound impact on economic outcomes as well. And you can see here a study from the UK about the cost associated directly with negative mental health issues. So we put out a resource just last week, which actually looked at 7 evidence-based strategies that the folks can really look at using when they're optimizing their health when working at home. And I'm going to go through some of these and then just point out how they also impact mental health as well as physical health. So I'm not going to read these. You guys can download this resource off fitwel.org. So if we look at the first one, which is connecting with nature, I think it's really interesting that we know now so much about the positive impact that access to nature, views of nature, being in nature, all of these have on both our physical and our mental health. And you can see from this study that depressive symptoms are specifically addressed when people are within a natural environment, when people are within a tree canopy, specifically is what this study was looking at. But 2 things to really point out here is that you need the access to nature, but it also needs to be well maintained. So if you are in well-maintained, high-quality outdoor spaces, it has a positive impact on mental health. It also has a positive impact on trust. However, if that space or if that greenery isn't well-maintained, it actually has a very significant impact on trust, a very negative impact on trust if the space isn't well-maintained. So very important that we are in well-maintained, high-quality outdoor spaces and nature. The next one is natural daylighting, which seems so simple and yet has such a profound impact on our health. So this is obviously whether you're at home, whether you're in a work environment, any aspect of your life. Access to daylighting, knowing what time of day it is, actually being directly in sunshine or in light affects many aspects of our health. But what we're going to talk about with mental health is it really actually affects your sleep and your circadian rhythm. So if you have a lot of access to daylight, you will actually most probably sleep better because you will be more in line with your circadian rhythms. And it's very important to get a good amount of high quality sleep because sleep affects so many different aspects of our health. It impacts your stress levels, it impacts obesity, it impacts a lot of other chronic diseases. And what we've seen, certainly in New York City, those who are most affected by COVID-19 and actually die of COVID-19, of those, 89% have comorbidities. So they have an underlying health issue, heart disease, diabetes, obesity are among the highest risk factors for death from COVID-19. So yes, we need to address the immediate infection, and we need to really look at mitigating the spread of the infection, but we also need to be looking at how do we support a healthier population? How do we address chronic disease so that even if we are in a situation with a new pandemic or some other emergency, the underlying health of the population is optimized, and is optimized thinking of equity as well, because we see great inequity across our populations. The next is really looking at, certainly, yes, eating healthy food, getting physical activity, staying hydrated. They all have an impact on mental health, but it's not a direct impact on mental health. One thing that does have a direct impact on mental health is actually gardening. So gardening is, obviously it's a physical activity, but it also impacts depression and anxiety, stress, and mood disturbances. And this is actually one of the least used strategies in the Fitwel system, both on the residential and the commercial side. So having access to a fruit and garden area within a property is very unusual, certainly from our perspective from Fitwel, and yet it does have such a profound impact on all aspects of mental health. So we will certainly be promoting this as we move forward. We were going to anyway, but it seems even more relevant these days. It also encourages people to interact with one another. It encourages multi-generational interaction. It actually also, there's evidence that if you're involved in a fruit and garden patch, that you're more likely to consume the recommended amount of fresh fruit and vegetables a day. So there's a lot of benefits to gardening and fruit and vegetable gardening specifically. The next strategy is really looking at air quality, and both indoor and outside air. So indoor air, this is where we're having like some of the most opportunity around how to mitigate the spread of the virus, in really looking at how do we ensure that indoor air quality is optimized to mitigate transmission of infectious disease. So these strategies include filtration rates, they include increasing the amount of fresh air that's coming into the system in order to disperse the infection, disperse the infectious disease, but also looking at humidity with some caution, understanding that that can increase mold if it isn't balanced correctly. But there's going to be a lot of solutions that really look at indoor air quality. I think it's also important to point out outdoor air quality. Outdoor air quality has actually been seen as a risk factor for COVID-19 if you're in a polluted air quality area. It also affects your mental health. So being close to a major road and having access to that kind of the noise and the pollution actually increases anxiety in some populations. We have put out a resource which is looking at optimizing buildings for COVID-19 prevention. So this is really looking at mitigating the transmission of infectious disease. So educational signage, I think we're going to talk more about that with the next folks speaking about what they actually have been doing within their spaces. Cleaning protocols, there are some very specific cleaning protocols that help to mitigate the transmission of infectious disease, specifically COVID-19. Increased ventilation, I already mentioned, maintaining optimal humidity, and then filtering indoor air. So we have put a worksheet out on this with specifics for each of these and what you should really be aiming for as a best practice. And I'm just going to conclude my remarks with just letting you all know that we as a Centre for Active Design and the operator of Fitwel will be putting out a technical resource which is going to address all aspects of the impact of COVID-19. We're going to be putting this out in chapters. It is going to be a technical resource, so it's going to have a lot of citations and a lot of specificity. The first chapter will be looking at viral transmission and how to leverage buildings. It will then, the next chapter will be looking at building trust in the workplace. The next chapter will be looking at mental health in the time of COVID-19. Next, chronic disease and equity during COVID-19. And then lastly, how to create more resilient communities so that we can really be strong and optimize our communities moving forward. So we will be putting this out in the next few weeks, and obviously we will let you all know as that becomes available. So those are my remarks. Thank you. And I'm now going to pass it over to Renee. Thank you.
Great. Hello, everyone. This is Renee Loveland, and I just first of all want to thank Joanna and her team for inviting me to participate in this today. I am very excited to be a part of this discussion, and there have been so many developments that we all need to share so that we can learn from one another. So I want to start my remarks by sharing just a little bit of an overview on Gerding Edlen. Gerding Edlen is a real estate firm based in Portland, and we have a large portfolio that is mostly multifamily currently. We have about 12 multifamily properties that are currently in operation or about to come online. And we have a longstanding focus of making great places for people and really emphasizing the user experience in our buildings. So that has led us naturally to a focus on health and wellness in our work. And I think it's fair to say that we have sort of been designing with this notion of biophilic design, which is inviting nature into the built environment and using nature as inspiration. That's something that we have been doing for many, many years, and sort of long before we really knew that term. So I just think it's important to sort of understand where we're coming from, our legacy and sustainability, and our focus on, what it is like to actually live and work in our spaces. And I think we have a track record that sort of backs up, the work that we've done. In 2019, we became a Fitwel champion, which was very exciting, and it was really neat to have that framework in order to sort of put together these pieces around sustainability and health and wellness. And we earned 3 certifications on some new construction properties this past year, and we were scheduled to get underway with a certification on an existing office property, and then all of this started. So we're finding ourselves in a little bit of a pause on that front. And so the priorities that I'd like to share with you in our work today as we're kind of adjusting to this COVID-19 area are kind of in 4 main buckets. First of all, we are looking to adhere to best practices and guidelines from the health authority so that we can protect the health and safety of our residents and our staff. It's really important that our staff feel comfortable and confident about the operational decisions we're making, since they are representing us there within the residential community where they work. And we are actually, we have an internal management company, but we also hire outside property managers to manage some of our properties in the Bay Area and the Midwest and East Coast. So not only are we sort of working with our own management group and understanding best practices in that context, but also getting information through other companies that we work with in different markets. That's made it a little bit challenging, but also has been a great way for us to kind of cultivate a lot of different information. So next, we're trying to stay informed and nimble. As you all know, information is coming at us fast and furiously, so we just have to be able to react quickly and implement changes immediately when those are called for. And so there's a lot of monitoring of what all of these developments are, and that is very time consuming. So we've got people really with their eyes on that. And we are really looking to create trust with our residents. The messages that we are giving them, it's best that they reflect the same messages that they're hearing from the health authorities, so that there's that continuity and that sense that we're all on the same page and we sort of know what to do. Thirdly, protecting asset value. This is extremely important. We are looking to manage our expenses. We're watching our occupancy trend across our portfolio, and then really focusing on our resident love campaign. Property valuation is a real concern. There's a lot of uncertainty about how long this is going to last and how deep this is going to go. I think we've already seen it, hit so deeply. And so we've been shuffling dollars into different buckets. Some expenses are increasing, like janitorial, obviously, trash, and then others are decreasing. Our common area utility bills are decreasing since those areas are shut down. And so we're going through a lot of cash flow projections to make sure that we're managing our assets very closely from a financial perspective and an operational perspective. And then finally, reinforcing community. We really want to make sure that everyone, the residents who live in our buildings understand that this is a shared experience, that we have empathy and understand that this is very challenging for them, but that we have also spent a lot of time and effort over the past years on cultivating a connection through robust tenant engagement practices with our residents. And so we've used a lot of gamification. We've had a lot of social activities with sustainability themes, expanded recycling programs and other programs within the building, in addition to volunteer activities and community partnerships, all of which sort of creates that sense of community that we strive to have be exemplified at our properties, because we feel that that really adds asset value. So that being such a focus, we're using our resident portal, our social media, and even postings in our elevators to communicate to our residents during this really challenging time. We're encouraging social connections while we have to be physically distant. So given this backdrop, I'll go quickly through some highlights around operations, building systems, leasing, marketing, and our resident love campaign. From an operational perspective, as I said, we're trying to stick to the guidance that's coming out from the health authorities in the community. I've listed here the things that we have done to modify our building operations to adjust to COVID-19. A lot of this is going to sound familiar, but the main thing is shutting down the amenity spaces. That's really been where we've seen the biggest pushback from residents. That's been challenging, but for the most part we've been able to manage that, but we understand that residents will be very excited when they can take advantage of those spaces in the buildings, because we do promote them very heavily as wonderful amenities for the places where they live. From the building systems perspective, Joanna touched on this, we're looking to create a high quality indoor air environment. So there are a number of things that we've done, from increasing ventilation to more fresh air, confirming that our filters have been changed, and encouraging residents to open windows. From a marketing and leasing perspective, this is where I think we've seen a big pivot. We have 3 properties that are opening within the next 6 to 12 weeks. So it's really created some challenges for us, given the original marketing strategy. However, we have not only been able to adjust our marketing spend and think about ways to make more of that digital versus printed, we've also gone to all virtual leasing, and we are creating videos so that potential residents can use those to sort of guide them, give themselves a tour through the building, in an online format. So one of the really also important things that's transpiring right now is that we have several the properties that I mentioned have a lot of biophilic design characteristics, and those are the Fitwel certified properties. So we're taking the opportunity to train our leasing staff and our marketing staff in a much more direct and heavy way about the connection between health and wellness and the built environment. As we're all spending so much time staying indoors and thinking about how we feel within these spaces, it gives us an opportunity to make a better connection in those conversations with people, because they will have a more personal experience to relate to. So for example, at one of our properties in Boston, Bauer, we have view glass in the building, which is dynamic glass to control glare and heat gain, but also maintain that connection to the outdoors. And at a property in Portland, we have outdoor amenity terraces that have wonderful landscaping that sort of mimic the transition from the mountain to the valley. So a lot of really great connections to nature, but also just neat strategies that enhance that living environment for our residents. Our Resident Love campaign has been very very strategic. We want to show that we care, we're providing resources, and we're trying to maintain this continuity of programming. So we've gone through a suite of communications, and we can get into this a little bit more during the Q&A. I want to be sensitive to time. But our first communications were around, here's what's happening, we're sheltering in place, we're not taking work orders, and we gave a lot of resources, fitness classes, digital dance parties, meditation sessions, and also DIY hand sanitizer recipes, obviously wanting to reinforce the sustainability piece. Then then the next communications went through, here are the operational changes we're making and why. Here are some programs that we've expanded within the community and our retail partners to help you from a health and wellness perspective. So there is an outfit in Chicago called LulaFit that we've worked with very closely. And we're getting about 20 to 25 participants in each of our Chicago properties in the programs that LulaFit is offering, which is from fitness classes to healthy food preparation to kids activities, those sorts of things. We have quarantine spirit challenges. Participation in that has been a little bit light, but that's all done through the resident portal. We have sent communications about how DIY face masking and, tried to make it a little bit fun. It's a scary topic, but tried to make it fun with, here are some do's and don'ts. And then finally, Earth Day was a big event for us. It's something that we honor at our properties annually with a large social event at each property. Obviously going digital this year, we had to do things a little bit differently, but still wanted to highlight the fact that, yes, we are in this current pandemic, but there is this climate crisis that we all still need to be recognizing, and let's participate in this together today. So trying to make opportunities for people connect in this way, but also, make it fun in light of everything that's happening. So post-shelter in place, just quickly, how are we going to address what life looks like going forward? We know that social distancing will still be a factor, but we are going to have to start to open up our buildings. So how are we going to address the amenity spaces? Are we going to have people reserve those? Potentially, will we move furniture apart so that separation is achieved more naturally? Those are some of the questions we're asking. Enhanced cleaning protocols. Obviously, we want to minimize high touch points. We're looking at antimicrobial coatings and touchless technology wherever we can. Looking at how we are going to maintain circulation flows within the building, within the amenity floors themselves, and then just going up and down, making sure that we've got just one person or couple per elevator, and maybe dedicating stairwells for up or down traffic. And then finally, deliveries, trying to minimize the amount of outdoor traffic coming into the building. So thinking about creative ways to manage that and modify our package locker system. So that's in a nutshell what we have going on. There is so much happening and it's moving so quickly, but I think what we're realizing is that because of the work and thought that we have placed into not only the design of the properties that we have built, but also how we operate them and the program that accompanies them, we feel well positioned to sort of manage through this crisis. Thank you.
Thank you, Renee. And now we're going to move over onto commercial properties and hear from Melissa. Thank you.
Thank you, Joanna. Thank you so much for having me today. And thank you, Renee, for that very insightful. And it's interesting to see the overlap of what you guys are already doing with everybody at home and now what we are communicating to our clients. A little background on me. My background is sustainability, and I joined Cushman and Wakefield a couple years ago as VP of Sustainability and Wellness. And so I work with our global occupiers on their sustainability and wellness initiatives. A little background on Cushman and Wakefield. We are one of the largest commercial real estate companies in the world. We manage approximately 3.6 billion square feet of property. We have about 51,000 employees in approximately 400 offices in 70 countries. And the reason I say that is because as we move into the next few slides, you'll see the information we are disseminating to our clients and to our occupiers, building owners, landlords, etc. This is based on our experience as well as the information that we're gathering from our colleagues around the world. And so it's very thoughtful and experience based. Our company is split into about 9 different service lines. So you can see here, it's kind of a little difficult to see, sorry about that, but we have, tenant representation. So those would be our brokers, valuation and advisory, capital markets, asset services, and then I sit under the global occupier services service line. And then from within those 9 departments, we also work with a wide array of industries and sectors. So as you can see, we work with everybody from airports and hospitality to nonprofits and retail, and obviously office space is one of our key sectors. So everyone, usually when I talk about my job and working at Cushman, everyone wants to hear, what are clients talking about? Usually it's about sustainability, but now everybody wants to hear what our clients are talking about in terms of COVID-19. So the number one question that I've been getting from my clients is regarding cleaning protocols. It's also something we're talking about internally related to the Cushman offices. So what does the proper cleaning protocol look like? What happens if somebody within the workspace tests positive, comes down with a fever while they're at the office, and how does that work? Looking at mechanical systems, what do we do with those prior to opening? And then when the offices do open, how are we managing our mechanical systems properly? Looking at layout of space, pedestrian traffic, signage, and construction of new space. So Cushman and Wakefield put together an internal task force and of leaders in our industry, and based off of CDC guidelines, WHO guidelines, et cetera, international, based off of what our offices are already doing in China and throughout Asia, we created this recovery readiness how-to guide for reopening your workplace. So this is a great tool for any type of space. As I mentioned before, we work with everybody, every type of space possible. So if you are a small mom and pop shop, this could work for you. You can pull from it what you need. If you are a company that has a 200,000 square foot office space, which some of our clients do, this is also applicable to you as well. I just want to go back now to those questions that I had mentioned before and talk to you a little bit about how the recovery readiness guideline addresses these. So looking at cleaning protocols, just some things to note that is addressed in there. If somebody does come down with COVID-19, we don't have that addressed in the guidelines yet, but I did reach out to our asset services because it was something that kept coming up. And their guidance to me, which is pretty much seen throughout the whole document and all of our recommendations to our clients, is communication, communication, communication. So first, notifying the building owner, the landlord of the building, notifying the people within the space, notifying the cleaning folks, making sure that the space where the person who was sick is decontaminated, finding their path of travel and making sure that whole space is decontaminated, and then cleaning out the whole suite if necessary. So that is, and then in addition to that, just looking at cleaning protocols overall, some things that Renee had mentioned, we are also suggesting, such as, making sure that the proper cleaning supplies are there, whether that's hand sanitizer, which, just as a side note, you want to make sure that that is alcohol based. There are some hand sanitizers out there that have carcinogens in them and are not should not be used frequently, but I think one-off or an alcohol-based hand sanitizers are okay once in a while. But recommendation is you should be washing your hands with warm soap and water first and foremost, and then the hand sanitizers back up. And then making sure that your cleaning folks are adequately educated on what they need to be doing. I did have a client who's a large company in Boston whose cleaning folks did not want to clean after somebody came down with a fever. This was right before shelter in place. And they ended up having to hire somewhat like a hygienist or a hazmat type team to come in and actually do the deep cleaning. I think now since then, most cleaning companies are more educated on what they need to do and not do. But that's all addressed in the guidelines. And then looking at mechanical systems, making sure your filters are changed out prior to folks coming back into the space. I think a lot of our clients probably reduced the airflow and the settings while folks were not in the office spaces. But now, as people start to come back into the workplace, making sure that there's adequate airflow, opening windows if possible, doors if possible, to let fresh air in as much as possible is also key. And then another topic that keeps coming up, the construction. We do have projects that are on hold right now, as I'm sure many of you guys know who are on the call. Unfortunately, we don't work as much in the multifamily space, which I know that is moving forward. But so for our construction teams that are on hold, we're taking advantage of this time to make any make any upgrades and kind of become educated on how we can go back to the construction sites when they are ready for us. So one of the key takeaways from our guidelines is this Cushman and Wakefield's 6 feet of office. And so it looks at different aspects of your office space. You can see here, this is a floor plan showing arrows. One of our recommendations is maintaining one straight path of traffic. So whether that's clockwise or counterclockwise from your main point of entry, and making sure that people maintain that traffic flow is key so that you don't have people cross-contaminating a space. And then in addition to that, making sure that you have ample signage throughout the space so that people are reminded, oh yeah, right, I can't turn left this way, I have to turn right, and you have to go all the way around. And that's going to take time. It's going to take training and education for our occupants, but in the end, it's the right thing to do to reduce viruses transmitting. And in addition to that, one of the things we talked about, it's not in here, but we have an office space in downtown LA, huge, multi-story office space. And how do you get different tenants into the building at one time? So we've decided to, or not decided, but we are talking about possibly staggering entrances so that one tenant enters at one time in the morning, another tenant will enter at a different time, and making sure that those folks from the different office spaces are not commingling together in our lobby, possibly having circles on the lobby floor spaced out 6 feet apart so that as you enter the space, you're not on top of the person in front of you, and things like that. Also hiring facility folks to come in and guide tenants, occupiers into the building and making sure that they understand the flow of traffic and what they should and shouldn't be doing as they get into the space. Looking at the rules, making sure that as you open up your space that you have the rules in place before people start to come back in, making sure that those are posted so that everybody can see them easily when they enter into the space, and then probably posting them throughout the space so that as a gentle reminder as people move throughout their day. This is a great example of what a possible workspace could look like. We are talking internally about adjusting our floor plan to space folks out a little bit more. The guidelines give you great ideas as to how you can do that. Everything from converting conference rooms to more desk space and spacing people apart in bigger conference rooms. This here is an example of our Netherlands office. I think it's beautifully done. They've incorporated the black circles underneath the desks to give folks a reminder as to not getting too close to the people at the desks, making sure that you stay 6 feet away, and then having obviously not as many people close together, really spacing them out as far apart as possible. And then in addition to that, as I mentioned before, just having some facility folks available, or even somebody internally who can come and guide people throughout their day, making sure that there are cleaning products readily available to employees within the space. I know that we have cleaning folks for the building in our space in downtown LA, but making sure that actual employees within the office have their cleaning supplies readily available to wipe down when you enter and before you sit down at your desk, and then again to wipe it down before you leave. And then, as Joanna mentioned earlier, obviously the mental health of our employees is our highest priority. One of the things that we have done at Cushman and Wakefield is we created a survey called XSF at home, so experience by square footage at home. And this went out to all of our employees around the world. And it was a great way for us to see how folks are handling. Do they have the right tools that they need? Do they have the right environment? Are they in a safe and healthy environment? Are they able to get daylight and be and go get out and get outside and have exercise and things like that? What was so interesting to me was that our millennials, our younger folks, are struggling really badly with this. They're having a very difficult time with this transition, and we could really see that in the survey results. The boomers seem to be doing the best, and then the Gen Xers like myself are somewhere in the middle. And then our sales team, our extroverts, are also struggling. They are having a difficult time, as I'm sure you all can imagine. They thrive off of that energy, team camaraderie, etc. And so they've also been having a hard time. And I think as we talk about who will be going back into the workforce, obviously looking at folks who have compromised immune systems, they will not be going back first. But looking at teams that do need to go back first, who are healthy and want to go back, looking at folks like the millennials, and then teams like sales teams that thrive in that environment. I think that'll be key for them to improve their mental health and help them a little bit more. And then another thing we've been doing is promoting personal interaction. So we have some work from home selfies. This is me working outside while my husband was on a phone call and my children were taking recess to add on to all the confusion. So, I think everybody's doing what they have to do. It's been so great to see what my colleagues are doing around the world, or well, at least in our LA office, to see that their working environments and see that they're happy and healthy. So that's been really, really helpful. And then also just making sure that our clients and that we internally at Cushman and Wakefield are also providing services to our employees. And we have a great website with all of the childcare and dependent care. People have parents that they need to take care of, or other family members, etc. And then making sure that they have the mental health services that they need to talk to people. So those are some of the ways that we're looking at mental health and trying to improve that and giving our employees adequate services to help them along. And so that's it for me, and I look forward to any questions you guys might have.
Thank you so much. So we welcome questions. We have built-in time to have your questions because we certainly at the Center for Effective Design are getting questions every day. And I'm going to kick it off with a question that we received before the webinar, and it was around fever screening. And we've had many, many questions about the efficacy of fever screening and whether this is something that building owners should be providing, whether this is something that employers should be providing, whether it's something we should be doing at all. So I think I would love to share a little bit on what the research says, because we've actually finished a review of the literature at this point. And then I'd love to turn it over to Melissa to see what she's hearing again from her clients on the commercial side. I do think that this is not a residential strategy. But I'm going to just kind of kick it off with that. So on the fever screening front, I think what's interesting is that most of the research is from SARS. Obviously, there's not a lot of research around COVID-19 specifically at this point. But what we see from the research post-SARS was that fever screening was actually quite effective with the SARS virus. But the SARS virus is actually a very different virus in the way that it presents than COVID-19, because it actually starts with a fever and starts with people being very ill. Whereas, as we all know from COVID-19 now, that there's very high levels of asymptomatic people with COVID-19. One survey of one of the cruise ships was that it was over 30% of the people who had the virus actually were asymptomatic. And then, of course, there's this long lead time before folks develop a temperature if they do have it. So people can be spreading the virus without knowing and without having a fever. And so obviously that would not be picked up by fever screening. So one study that has come out specific to COVID-19 around fever screening suggested that in the best case scenario, you would be approaching 50% as far as how many people who were affected by COVID-19 were actually being picked up by the fever screening. So just less than 50%, I think, was the most optimistic opinion about the efficacy of fever screening. It does also obviously bring up legal questions. And where it is seen to be most effective is when it is part of a larger policy that really looks at what do you do if somebody tests positive for having a fever, what are the other policies in place, hospitalization, counseling, kind of you need to look at this as part of a greater policy in addressing people who are sick. And then I think the response as far as whether the real estate industry is moving towards fever screening really depends on your perspective of if you are the owner or the operator of a multi-tenant building, if you are the owner or operator of a single tenant building, a large tenant, or if you are the tenant themselves. So certainly from the discussions that we've been having with the real estate industry, those who have multi-tenant buildings are erring on the not screening side. Those who have single tenants are really going with what that tenant is looking for as an employer. And then employers and tenants do seem to be the ones who look like it's going to maybe end up being their responsibility to do fever screening if they decide to do it at all, understanding it is not a panacea. And then the other sector, retail, look like they're leaning a little bit more towards maybe doing fever screening as part of a more holistic approach. But I would love to know, Melissa, what you're hearing from your clients and Cushman & Wakefield's kind of opinion on this, if you've come to an opinion.
Right. Yeah. And I think similar to what you're saying is I think every situation is different and is unique. And we have not determined yet if that will be happening within our space in downtown LA. Our clients, I have heard it mentioned a couple times, like that could be a possibility even at the construction sites. I think that came up at one of our calls a couple weeks ago. So we are talking about it. Our recommendation right now is really determining what makes most sense for each building and each client. So we haven't really made a defined recommendation yet.
Great, thank you. And then Renee, a question that we've received from one of our listeners is actually for a little bit more detail on actually what you did as part of your Earth Day campaign and what you were able to roll out digitally and kind of how that compared to the in-person events that you've held in the past.
Yeah, sure. So the Earth Day event this year was sort of a virtual challenge where we encouraged residents to participate in one of 4 ways and then post accordingly. So we have a green power purchase option at all of our properties through a third-party provider. So we promoted that and said, if you sign up for that, post about that, and you'll be entered into a drawing for a prize. And we also have an expanded recycling program, so we wanted them to read up on some materials about the batteries and the e-waste and whatnot that we offer at the property. Third was energy efficiency strategy, so we promoted the programs through the local utility companies. They have resources about how to save energy in your home that are very simple and straightforward. So we asked them to read that and post about it. And then finally, there was this Share Your Air. Earth Day 2020 had a where you took a picture of outside and you posted it, and there was some kind of global sort of overlay that got pulled together so that they could get a sense of what's happening in different areas across the country and the world, I guess. So that was an interesting one. And so it was really just a way to encourage people to share experiences. That's ultimately what we're after. And so it was similar to the weekly quarantine spirit challenges that we're doing, where, please, take a picture, share a story, post about it. Let's kind of remind each other that we're still here. We're not seeing each other very much here in the building, but we're trying to keep people connected virtually as much as we can.
Great, thank you. You did also mention that you have buildings that are going to be opening in the next, hopefully,
yes.
couple of months, I understand.
Yes. Right. We're trying to close out construction. Yeah.
Yeah. I mean, that to me feels very optimistic. I mean, optimistic in that it makes me feel optimistic, not that you won't be able to do it. So let's talk about that, because we're all building professionals, right? What we love are buildings and construction and so on. So what are the challenges in closing out that construction? And are they for sale or rent, or how are you conducting that side of the business?
Yeah, so these are the properties in question are multifamily rental properties, and they all have ground floor retail as well. So, and actually the 5 MLK project here in Portland is mixed use. There is a strong office component as well. So we have retail, office, and the housing. So the challenge has been just continuing construction, and different markets are having different rules. I heard that Seattle might let us start up again. We have a large project there. Boston has been completely shut down for some time. Portland, we have been able to still go, have construction personnel on site, but it's been limited, and there have been new protocols that have had to be put in place, obviously. So we sort of have to just see what each market lets us do, and we just had to adjust all of our startup budgets and our projections, and just sort of take into consideration all of the new factors that are affecting, how this building will lease up and ultimately perform.
Very interesting. And are you finding that investors are asking you what you're doing, in light of COVID-19? Are they kind of asking for specific?
That's a really good question. We actually were pretty proactive. We were very proactive in sharing with our investors. I think it was the very first week, we sent out a communication to our investors, and made sure that they knew that we were addressing these, this challenge operationally, that we were looking at things very closely, and we were prepared to pivot as needed to, again, protect asset value and make sure that everybody's safe and healthy in our buildings. And so we got some very good feedback right away based on that initial touch point. And then we just issued our annual environmental and community impact report for 2019, which is a report that we do every year to quantify our impacts in terms of people, planet, and prosperity. And we preface that again with an intro on sort of how we're managing the COVID situation at our building. So far we've gotten some good feedback about being proactive and communicating. I think that, that's, as Melissa said, communication, a lot of communication. It's reassuring, and it's welcome.
Absolutely. And the last question is going to go to Melissa. So this is again a question from folks listening, and it's going to be twofold because I'm going to add to it.
Nice.
So, hand washing stations. Are you considering hand washing stations throughout commercial properties? And then I would like to add on to that about like the permanency of, if that's a word, how permanent you see the operational changes that you are currently recommending to your clients. Are you planning for a year? Are you planning indefinitely? Or is it just kind of figuring it out as you go along?
Well, going to first the hand washing, I would say I think it's difficult in our spaces. I'm thinking about our building in downtown as an example. and I think it would be difficult to incorporate washing stations throughout. But what I am thinking is how it would work is you would come straight into your office and go straight to washing hands. There is a lot of talk about, and not necessarily for our space, but just in general, about ways to reduce the touch points, whether that's keeping doors open, making sure that paper towels are right next to bathroom doors so people can walk out and throw their paper towel directly into a trash can, make it very easy for occupants. And making it more of just a training and education of habits. And so you walk into your building, you wash your hands, you go sit down, you get up, you go wash your hands before you leave, etc. I'm sure that some folks may start to look at installing washing stations, but I haven't heard of that yet. And then in terms of how long we're looking at these new operations, I think right now it's indefinite. I think, one of the questions I get asked often is, do you think that tenants now will not lease as much space because maybe more people are working from home? I think that is all going to play out, and everything will be unique to each individual tenant and occupier. So that is yet to be determined. But I think that we are establishing some interesting habits and operations that will most likely keep going. I hope that eventually we won't have to wear PPE and things like that, but possibly, making people wash their hands as they enter a space might be something that's beneficial. So, I think it's all up in the air right now, but I'm sure some stuff will carry on as we move forward, and we'll see how employees engage and what works for them and what's not working.
Great. Well, thank you both so much. And thank you to everybody who has attended today and for your questions. Please do stay in contact with us. We are getting questions daily, and we are looking to answer those as quickly as possible and include the answers also in that new technical resource that will be coming out. So thank you again to Renee and to Melissa for all your great insights and your time and your ongoing leadership of health and wellness. Thank you, and hope everyone has a great rest of the day.
Thank you, Joanna. Thank you, everybody.
Thanks.
Thank you. Goodbye.
Bye.